I help women thrive and move past their cancer on their cancer journey by giving them all the options and assisting them in making the decision and helping them to make the decision for themselves about what treatments they want to undertake. I have a family history of breast cancer. My mom's sister was diagnosed at 44. I had routine imaging and I thought I'd felt something before I went, so I had an ultrasound. During the ultrasound, I thought, gosh, my breast tissue looks really dense, denser than I thought it was. I had an MRI and the cancer was on the MRI.
Gosh, I was a single mom when I got diagnosed. I had a 10-year-old son at the time, he's 16 now, and had to balance all of that while I was going through treatment. I think that's one of the hard things is, you get a cancer diagnosis and you feel like you should get this free pass where none of these other challenges in your life are supposed to be there. Everything else is supposed to be smooth sailing. But for myself and for so many of the people I encounter in the office, that's just not the case.
My initial diagnosis was not just for one breast cancer, but ultimately I had 3 breast cancers, 2 in my left side, 1 on my right side. My surgeon was Dr. Michelle Lay here at Arizona Oncology. Before I was the person providing care for patients and trying to get my breast cancer patients through their journey. Now I completely understand their journey.
I think what's interesting about having cancer as a cancer provider is that we really have all the same emotions that our patients do, but we have to manage them in a different way because we have to still go to work and talk to people about their cancer. The anxiety that people get about their diagnosis, I think that happens both to people who are physicians and people who are our regular patients that don't know as much about oncology as we do.
So I think one of the things that I do differently as a surgeon, and this probably comes from my own experience with breast cancer, is I spend a lot of time talking to my patients about how to manage their emotions and their anxiety during those first few weeks of treatment.
I help my patients thrive with and beyond cancer by providing them someone that they feel that they can talk to about any part of their breast cancer journey and providing them the treatment and the support that they need for as long as they need it here at Arizona Oncology.
I think Arizona Oncology really does a great job of focusing on the quality life of the patients. They really want to know what's happening in your life and what do we need to do to support you. We have social workers and navigators and all kinds of people that are looking at how we can lift you up during this time when you need an extra hand.
One of the key areas in which Arizona Oncology stands out from other oncology providers is that our physicians care intensely about the well-being of their patients. We care about the entire patient, not just their cancer, and helping them to return to a meaningful life after their cancer treatment is finished.
Life is a beautiful thing that we should all embrace, and there's many things for us to do here, and that is why we continue to thrive.